Hey everyone, welcome to my channel, The Philosopher. I hope you are doing well. And as you all know that I am making videos on general medicine, but before studying general medicine, we should be familiar with certain terms that are frequently used in clinical medicine. So let's get started. In this video, we'll get to know about sign, symptoms, diagnosis, prognosis, treatment, and illness. Let's talk about sign and symptoms. See, symptoms are the complaints that the patient tells, and signs are obtained by the examiner. Okay, so let's see the difference. Sign is objective, it is observable, and it is evident. Hence, it can be identified by anyone, be it doctor or the patient itself. Here the term objective means something which is factual, something which is based on facts. So its examples are cough, skin rashes and pallor. These signs are easily identifiable. Okay. Symptoms. Symptom is subjective. It is apparent only to the patient. Hence it cannot be identified by everyone unless the patient tells himself or themselves. Okay. Here the term subjective means something that is personal, that is apparent only to the patient. Okay. So we can say that it is something that drives the patient to the doctor. Example, if the patient complains of body pain or fatigue or any type of ache or cramps or blurred vision, all these symptoms cannot be identified easily by doctor. These complaints are patient's own complaint which he is feeling. So it is something personal. So symptoms are subjective. Okay. Let's see what is diagnosis. By definition, diagnosis is the act or process of identification of a medical condition or a disease made by evaluating signs and symptoms. I hope you got it. Diagnosis, it can be clinical diagnosis and lab diagnosis. Okay. Clinical diagnosis, it is simply based upon physical examination. It is simply made on the basis of medical signs and patients' reported symptoms. Okay, so it is simply made on the basis of medical signs and patients' reported symptoms without involving any kind of lab findings. Okay, while in laboratory diagnosis, uh, it is based significantly on lab reports or test results rather just the physical examination of the patient. We can also say that clinical diagnosis is based upon physical examination. Yeah, I already told you that. Okay. Let's see what is provisional diagnosis. Provisional diagnosis means general diagnosis. Okay. It is also known as tentative or working diagnosis. In provisional diagnosis is an initial diagnosis from which further investigations can be planned. A provisional diagnosis means that a doctor is not 100% sure of a diagnosis made because more information is needed. He is just simply making an educated guess based upon signs and symptoms of the patient. So we can say that provisional diagnosis is initial diagnosis, it is a general diagnosis, and it is just made by educated guess of the doctor. Based upon signs and symptoms of the patient. Differential diagnosis. Differential diagnosis is the process of recognition of a particular condition from amongst others which closely resembles it in certain aspects. Okay. For example, if the patient complains of oral pain. So what could be the possible diagnosis of oral pain? We can say he may be suffering from pulpitis. Okay, but if the patient is edentulous, then this diagnosis will be ruled out. Okay, edentulous. When a patient is said to be edentulous, it means it has one or more than one teeth missing, or maybe his whole set of teeth are missing. Okay, so the patient is termed as edentulous. So in case of edentulous patient, the cause of the cause of oral pain or the possible diagnosis for oral pain could be denture stomatitis. Okay, could be denture stomatitis. Yeah. Now we can also say that in differential diagnosis, a doctor differentiates between multiple diagnoses to determine the correct one and make an appropriate treatment plan. Okay, so the doctor makes out an appropriate treatment plan after doing differential diagnosis of a disease or a condition. Now let's see what is prognosis. Prognosis means, see, in prognosis there is a prefix used pro. Okay, pro means uh, the prefix pro means knowledge beforehand. Okay, of how a situation is likely to turn out. Means what would be its recovery rate. Okay, it is considered opinion of the probable development and outcome of the disease. It is a considered opinion of the probable development and outcome of the disease based upon all the relevant available facts of the case. Also, if you want to define prognosis, according to Goodman et al., prognosis is the prediction of the probable course, duration, and outcome of disease based on general knowledge of the pathogenesis of the disease and the presence of risk factors for the disease. Okay. Let me give you a brief about treatment and illness. Treatment, it is the course of action which is adopted to deal with illness and control of the patient. Okay, and illness, what is illness? Illness is defined by sum of effects, predicaments and repercussions of the disease, deformity or circumstances. Okay, the term predicaments means a certain unpleasant condition or a situation. Okay, and repercussions means uh, consequences, outcome of the disease, deformity or circumstances produced in a patient. So that's all for today, guys. I hope you liked the video.